Attention hospital HR in Canada. Are you in search of the perfect insurance solution for your part-time and casual employees? Look no further. Meet Healthcare Providers Group Insurance Plan, your go-to option for ensuring the well-being of your team.
With healthcare providers, also known as HCP, you're not just providing insurance, you're providing peace of mind. HCP's comprehensive coverage includes medical, dental, and vision benefits designed to keep your part-time employees happy and healthy. There's even a package that includes life, long-term disability, and accidental death, disease, and dismemberment coverage for those who already have other group health and dental coverage.
It's time to bridge the gap between full-time and part-time staff benefits. With Healthcare Providers Group Insurance Plan, you can level the playing field and show your commitment to all of your team members.
Join the community of over 145 hospital sites who have made the smart choice. Visit healthcareproviders.ca today to discover how HCP can help you support your team in a meaningful way.
Is this thing on?
I think they can hear us a bit better now. Do you think they are ready to change the status quo?
It's one thing to get them listening, but now let's get them to act.
You are now about to witness the strength of nursing knowledge.
Hi, and welcome to the Gritty Nurse Podcast, an unfiltered and unapologetic podcast which discusses health and healthcare. My name is Amie.
My name is Sarah.
And we are your hosts.
Don't forget to hit the subscribe button wherever you listen to podcasts, Google, Spotify, iTunes, or our YouTube page. Please rate and review us.
Make sure you get our book, The Wisdom of Nurses. There's no better gift than giving the wisdom of nurses to nurses during Nursing Week.
Hey everyone, and welcome back to the Gritty Nurse Podcast, a podcast on health and healthcare. My name is Sarah.
And my name is Amie.
And we are your podcast hosts. So today we have a really exciting guest. His name is Len Pierre. I actually heard Len speak at the BC Nurses Union Conference, and I thought his message was really powerful. And so I think this is going to be a really great conversation. So without further ado, I'd love to let Len introduce himself today.
Yeah, absolutely. And Heichka, thank you so much for having me. So my name is Len Pierre. My ancestral name is Palikulak, and I'm Coast Salish from Katzie First Nation on my father's side and Musqueam First Nation on my mother's side. I'm the owner and CEO of Len Pierre Consulting. We are a relatively new consulting group, Indigenous consulting group that specializes in primarily education and training, but also project management, strategic planning, and cultural advising for any willing service provider throughout North America.
Amazing. I think that is really great that there's someone like you in this space. It's so needed, and we're really excited to learn more from you today. I know that when I heard you speak, you shared a lot of personal stories in your talk, and I'm just wondering how you began this journey, or was this something that you had started a long time ago? Is this fairly recent? How would you describe your journey into what you're doing right now?
Yeah, well, I always identify as a like an accidental consultant. this career, this career trajectory, really was not in my trajectory, 5 years ago, 10 years ago, or if you can think back all the way to your time in high school, where the adults in your life are pressuring you to come up with, the one decision on what you're going to do with your life for the rest of your life.
Right.
I did not know you could build a career talking about things like Indigenous cultural safety, Indigenous culture and history, let alone reconciliation and systemic anti-Indigenous racism. I did not know you could build a career out of that, let alone a company. So my background is primarily in the area of education. So I'm by no means a clinician. I cut my teeth in my career by working in the education system, and I have my master's degree in education. And what I found, how I jumped from the public education system to working in corporate healthcare today, is really around having my lived experience of being a young man growing up on reserve from Kate-zee First Nation, immersed in culture and language and traditional practices. I found an ability to teach teachers about our history and our culture and contemporary issues. And somehow I found my way into working at the First Nations Health Authority around 2016. And when I was brought on to develop education programs at First Nations Health Authority, I found this ability that what I know in my brain, is not common knowledge for nurses and doctors and, chief medical officers, you
Right.
name the profession in the healthcare institution. I found that was not common knowledge. So that was news to me.
Mm.
So through the more time I spent in healthcare from 2016 onwards, word really kind of started to spread that my background in public speaking too really just kind of gave me more and more platforms where I would speak virtually. This is during the pandemic, speaking virtually to thousands of healthcare providers in our local health authority of British Columbia, health authorities. And people are like, oh, we like the way you talk about cultural safety. Will you come talk at our next conference? Will you come speak at our next AGM? And I'm like, yeah, sure. At that time, I worked for Fraser Health Authority. So it was really quite organic and quite by word of mouth that I found an opportunity to be able to, and I guess I form words relatively well in a way that's non-threatening and more warm and inviting for non-Indigenous peoples to learn about some really uncomfortable conversations of our shared history in this country, like genocide, racism, prejudice, discrimination, oppression, privilege, and power. The way I frame those, it's what people tell me is that it's non-threatening. And so, through that reputation, I've been able to really go out on my own as a rogue agent working for myself 3 years ago, and start a consulting practice. And I was so worried back then that I wouldn't have enough work to keep my head above water. And fast forward 3.5 years later, I now have a team of 25 Indigenous consultants and non-Indigenous consultants who I get to work alongside, really leading the change and helping organizations to decolonize, to embed reconciliation and Indigenous cultural safety for their organizations. So long story short, it's been quite organic, quite yeah, just going with the flow of the work and just the calling of organizations who are like, hey, we have an opportunity, will you come speak with us? Or we have this project, will you come work with us? And so that's how we kind of came into formation, was just by answering the invitation for now, 3.5 years later, countless organizations across Canada. Because we don't just work with healthcare institutions, we work with government, we work with social services, we work with the justice system, we work with the private corporate system. You name the system, we probably work with them at LPC.
Wow, that's amazing. And I think, of course, the question always is like, is this the right time, or why is it that this work is being done? And I think the answer to that is this work is always needed to be done. And it's just that, you were able to see it in a timely manner to start having these conversations, because we need to have the conversations. We've seen time and time again, particularly as Sarah and I are nurses, the harms that befall patients who are Indigenous or other or racialized. And we need to have a conversation about, cultural safety. And I took Signeus. I know how much you know about that, but I'm probably
Yeah.
sure you do.
Yeah, I took that
Yeah.
as well.
And it was very, very eye-opening in terms of understanding, because again, sometimes you don't know what you don't know. And it's good to have those conversations. So again, thank you for some of the work that you're doing and that your entire team's doing, because it's well needed, and we definitely need it in healthcare. One of the questions I'd like to ask you, kind of after all of the different, things that I've heard that you've been doing, that sounds really excellent, is maybe you can touch upon some of the accomplishments that you're most proud of in terms of some of the work that you've done.
Oh my gosh.
Come on.
Um,
I mean, we know there's something there.
yeah. Oh, I think there's a lot. I think there's a lot that I'm very proud of, the accomplishments that we've been able to achieve in such a short period of time. 3.5 years is not a long time. And, what I've learned is that building a company, it's a 5-year endeavor. So going from one person to 25 in 2 years was a huge undertaking.
Yeah, I'd imagine.
And I don't think I fully understood what the heck I was doing when I was doing that. I just knew that the work was, as you're saying, the work was so needed. So I needed more consultants, I needed more speakers, I needed more facilitators, I needed more elders and youth to diversify our own voices, because I cannot speak on behalf of every Indigenous, group and organization and nation out there. So we have Métis folks, we have New Channel folks, we have many different folks on our team. So by far, expanding our team has been a huge accomplishment and undertaking. Number two, I would say transforming the way the corporate sector learns has been a huge accomplishment in my mind. Take, for example, our new experiential learning program we have with Doctors of BC here in British Columbia. We take doctors out of the institution of healthcare, immerse them in a night of learning that is built on cultural protocols, prayer, ceremony, feasting together, and learning from one another. That's incredibly bonding and healing at the same time.
Mm.
Is like our most transformative work environment, right? Like I know Sanyas, I know, there's lots of different ways of learning about cultural safety today, but to do that in community, in a First Nations community on reserve, is like one of the most impactful learning opportunities. And we've been able to develop that and offer that as
Wow.
a package to sell that is now being hosted by ministries and policing detachments. That's really kind of bringing this heart that's usually headspace learning and bringing it down to a heart-centered level. A heart-centered
Wow.
way of learning this work is one of my proudest accomplishments anyway, that I do not alone but with my team. Those are two that come to mind anyway.
That's exciting. I think that I really like the whole experiential learning aspect where you're using all your five senses to learn versus clicking on a computer screen, which is just, it can get a little dry, but I really appreciate the effort you put into it. And just going back to what you said, you were worried at the beginning that you wouldn't have enough work. Well, it couldn't have been more the opposite. You have a team
Right.
of 25 now because you can't do all the work. So I think this just shows that, sometimes we have self-limiting beliefs to where we think something can't be done, maybe because no one's done it before. But I'm really glad that you heard the call, you filled that need, and you're continuing to grow. I know that you talk a lot about Indigenous health, and some of the topics that you mentioned are cultural safety, trauma-informed practice, allyship, and anti-racism. So I have another interesting question for you. From your
Mhm.
perspective, what do you think is the most pressing issue in healthcare that's affecting Indigenous people right now?
I would say the most pressing issue is the lack of understanding of the why. And I think that would also be another proud moment that I would have for LPC, is we really start with the why. That I learned from Simon Sinek, is always start with the why. Why are we
I'm
here?
just
Why should we be
Yeah.
doing this? I find that so many other cultural safety initiatives and trainings really come down to that. Well, just do this. Go do this. Go learn about this, right? And for many Canadian citizens today in a quote unquote air quotes multicultural society, is like, why are we learning so much about Indigenous people? Why do we have to do this? So what we do is we unpack the why. Why are we here? Why are we having the conversation? And the why really is just fully pausing, taking a step back, and recognizing that we live in a very colonial society designed with very few in mind, and that our colonial country is ultimately built on a very firm foundation of colonial ideology. What is colonial ideology? Colonial ideology is the idea that Indigenous peoples are less deserving, less worthy people. It sounds terrible. It sounds harsh. It sounds brash. It sounds like, oh my God, what do you mean? Not Canada, not this country, right? But it's ultimately the ideology that gives way to colonial countries all across the planet. Australia, New Zealand, the United States, and Canada, and the list goes on, are all built on colonial ideology, the idea that Indigenous people don't matter. And it's important to know that, because Canada would not exist if early colonizers and settlers came into our territories and said, you know what, we just need to respect the human rights and the human dignity of these local Indigenous folks. Canada could not exist with that framework. And so for me, that is the biggest missing context that's missing from all cultural safety programs, is how embedded into the infrastructure of our country systemic racism really is. It really is. And it sounds daunting, it sounds overwhelming, but that's why our work is so important, to provide the practical, very pragmatic, very accessible tools for mobilizing things like anti-racism, allyship, cultural safety, equity-oriented practices, trauma-informed practices, because then we can alleviate the harm and the burden off of Indigenous shoulders. And I say that's the biggest missing context, and it's the most pressing concern, because it's where we get this denialism that there's a problem, right?
Right.
It's like people just deny that there's a problem, and I'm like, no, there's a very large problem, and it doesn't just impact Indigenous folks, right? I know I'm talking to, to people of color, because I can see you, or what I like to call, people of color. I like to call the global majority, right? So it's like, Canada was designed through a colonial mindset. And so we all benefit from endeavors of cultural safety. We all benefit from decolonization work and reconciliation work. Through that solidarity and that allyship and that unity, I find that the work is so much more transformative and meaningful. I also like to honor and recognize that our institution of healthcare is colonial in nature as well. And as we're coming to learn, because of the global pandemic, it's also fundamentally flawed, right? And, it took the pandemic to really put a mirror up and be like, wow, like we never thought of these things for a long period of time. Health inequity in this country has been around for so long, and we're just now starting to see it. So those are the two things: how our healthcare system is flawed, and we're working on it, which is great, but also just the missing context of how deep the rabbit hole goes for widespread oppression and violence against Indigenous peoples in this country really is.
Yeah, it wasn't really until like you said, with the pandemic, that people had taken a deep dive, and that was because there was actually some data and information, right? I think a lot of our experiences tend to be anecdotal. So like, I tell a story that had happened to me in healthcare, or I hear my mom's story or another family member's story, and it might be similar for you, where we hear the stories of our various different cultures that have dealt with healthcare in a negative context, but we don't necessarily see it translate through the data. And I think with COVID-19, that was kind of the first time, even though we knew it, like we deep down knew what was happening. It was like, oh my goodness, wow, look at these neighborhoods who are not who don't have access to the vaccine. Oh, look at these neighborhoods that have really high rates of COVID-19 in them, or these particular areas don't even have access to getting the vaccine. I remember at the very beginning, we had myself and a number of individuals across Canada had like a national table where we talked about some of the things that were needed, and we had an Indigenous nurse come on and say, we didn't even get anything. Like, you guys are over there and you're on your second dose. We have nothing out here. And that was hard to hear, to be like, oh, wow, you hear people patting themselves on the back, and hearing on the other side of in Canada that folks just don't even have the resources. So it's like you said, the why is also because we've seen those historical harms, and we see that the harm is still happening. And that's why we need to continue, not just to have the conversation, but to do something about it. And that's why, me and Sarah are out here kind of like, okay, we're having the conversation. It's not just to have the conversation, but it's also to bring about that awareness that we need to do something differently. And I think that's also some of the work that your consulting organization is doing from a healthcare perspective. And I think it's so valuable in terms of what you're doing, because I think it always concerns me when I have these conversations. And again, I always come with the patient provider aspect as well, because I've been a patient in the system, and I've seen and I've heard too many times where people say, you know what, I didn't see color, or I treat all people the same. And we know that that is not the case whatsoever.
Exactly.
Attention hospital employees and retirees in Canada. Picture this: a benefit plan designed for casual and part-time hospital employees and retirees who aren't covered by their hospital's group health plan. Introducing Healthcare Providers Group Insurance Plan, a friendly partner dedicated to your health and well-being.
With affordable plan premiums and an exceptional support team, Healthcare Providers, also known as HCP, is dedicated to helping you every step of the way. Enrolling is easy, and you'll have access to a wide range of health and basic dental benefits from day one.
Already have health and dental coverage through another group plan? HCP still has your back. For less than $32 a month, the Signature Package, which includes life, long-term disability, accidental death, disease, and dismemberment, provides valuable income protection and peace of mind for the unexpected.
So take charge of your healthcare and financial security today. Visit healthcareproviders.ca to learn more. One of the other things that I want to ask you about was how can healthcare providers better provide care in a more culturally sensitive or a more culturally aware, I'd say, manner. One of the pitfalls I've seen is when we talk about quality improvement at the emergency department level or even just at the general hospital level, nobody wants to discuss race or racism. So how might we address these conversations like you do to healthcare providers?
Yeah, I kind of want to go back to your earlier point too around around cultural safety and I think that it's a very common misconception that cultural safety is only plays out at an interpersonal level, right? Like we're the healthcare provider, it's just
Right.
maybe kinder, more respectful to the Indigenous patient. And I'm like, well, hold on. You should already be kind. You should already
Right.
be
Yeah.
respectful. You
Yeah.
should already be a good person. A lot of people there's so many people that show up to our training sessions and they're like, okay, we got to be good people. I'm like, no, 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 no. You should already be a good
It's like
person.
that's the default, right? The
That's the
default is that you're
default.
just a yeah. Yeah, I
Yeah.
understand.
Ultimately, the way I look at both reconciliation and cultural safety is it's systemic. It's
Right.
Yeah.
systems level change and transformation. Everything from our workplace procedures to our processes to our policies to how we intake to how we do outtake to how we train people are all part of that change as well. So it's not just interpersonal, it definitely has to be taken at a scaffolded systemic level as well.
I was gonna say, do you feel that once you have when you do these trainings with various different hospitals and organizations, that you get a sense of feedback that like how do you know that people have heard the message and understood it? Because one of the things is the hardest challenges is yes, we'll have leadership at these types of these types of meetings and things, but the trickle down sometimes doesn't come to the people like myself and Sarah who might be at the bedside providing that care. So
Mm.
do you get a sense that that message is trickling down somewhat?
Yes,
Okay.
it does come up, but it's so fascinating because if you look at, let's say, if we took every training program that is offered in the context of healthcare today in a professional sense, so professional training sense, and so this is not university or post-secondary, but let's examine and let's just say for theory, we look at 100 different training programs that are offered in public healthcare today. How many of them are skill-based, competency-based, and measured, right? It's
Right.
always
Yeah.
Right.
technical. They're technical training, right? When it comes to cultural safety, it's so heart-centered. It's so emotion-centered. It's so reflection-centered. It's quality, right? And so it's so hard to measure those things. So,
Mhm.
we're always looking for these performance indicators, and it's like, okay, but it's also very long-term.
Right.
Uh, this work is intergenerational work. It's also very long-term work. It's a marathon, not a sprint. It's about consistency, not about intensity. And so what the approach that we take in our learning, our training programs is do people find that they are making meaning out of what they are hearing? Because what we're finding is that we're pumping through large groups of nurses and doctors through things like SANIAS, which is great, other cultural safety programs, which are wonderful, but we're finding that we're missing the opportunity to make meaning of it all.
Right.
And if we're
Yeah.
not making the meaning of it all, the transformation cannot come. So we heavily rely on a lot of qualitative evaluations, a lot of storytelling evaluations to be like, what did you find in this? What
Right.
sense are you
Right.
making of it? And so we find that about, more than half, definitely more than half, I would say about 75% of people that come through our trainings are like, okay, now I think there's a lot of connecting of the dots. Okay, we know about residential schools, we know about genocide, we know about systemic racism now because of the In Plain Sight report. And when we start to kind of connect these dots and find some takeaways for the short term and the long term, people are like, okay, I have some things I can do to lean and strive towards this change and transformation we see. And for us, we hold that with the utmost faith, hope, and inspiration for this work. Is that as long as people are walking away with some greater foundational knowledge and understanding of where they're going, the direction that they're going, when we have everybody going in that same direction, reconciliation and culturally safer organizations will come all the sooner.
Yeah,
So we,
I think that's an amazing message. Yeah.
yeah.
And I think that we're hearing more and more conversations around this topic, which I think is a great starting point, because I think, 10 years ago, we never really talked about Indigenous anything, to be honest. And so
Yes.
I'm glad we're hearing more and more of these conversations, and it's normalizing the discussion, which
Yeah.
I think, is really what we want to do. We really want to elevate this topic and give voice to those who haven't had voice in the past. And really just focusing on more recent events. I read recently, there was an article actually by the CBC that highlighted that Indigenous men were 7 times more likely to be murdered than their non-Indigenous counterparts. And I've heard a lot about missing and murdered Indigenous women and girls. I hadn't heard about this issue with men. So I'm just wondering if you have any thoughts on this topic.
Yes, absolutely. So, and this is very common in Indigenous health and social outcomes in all across the country for every one of our demographics. So we, in our Indigenous worldview, we do go beyond the binary of just men and women, right? We also have our Two-Spirit folks. So Two-Spirit folks are members of our community who identify as gay, lesbian, trans, queer, bisexual, Two-Spirit, non-binary. Our Two-Spirit folks, our men and our women, are all overrepresented in violence against them, but
Right.
also being murdered.
Mm.
And the same can be said for our children as well. The reason for these negative health and social outcomes is really coming down to what I like to call targeted trauma in this country.
Mm.
Targeted trauma is the residential schools, the 60 scoop, land theft, biological warfare against Indigenous peoples, forced sterilization of Indigenous women, the theft of children. The list goes on. That's targeted trauma. Targeted trauma will eventually give way to intergenerational trauma.
Right.
Intergenerational trauma is where we, pass on our traumas onto ourselves. Intergenerational trauma usually gets a lot of the time and the attention in dialogue and narratives today. But I'm like, hold up. The whole reason we have intergenerational trauma is from targeted trauma,
Right.
violence against Indigenous peoples. And so, and I know I'm singing to the choir here, but we know about ACEs, right? Adverse childhood experiences. The more ACEs you have, whether it's addiction or violence in the household or mental health and wellness in the household that you're growing up in, or if you've had a relative that's been incarcerated, those factors stack up against your health and social outcomes, and that goes for every human being. So as Indigenous peoples, we're highly overrepresented in those adverse childhood experiences as a result of intergenerational trauma, which is a result of state violence against Indigenous peoples. It's why men are overrepresented in high rates of suicide, high rates of violence, high rates of being murdered, police brutality, and it's no different than our Two-Spirit and our First Nations, Métis, and Inuit women as well. But that's where it kind of comes from, is the ultimate origins of those numbers always come from state violence.
I feel like kind of like the follow-up is like, so what do we do? Right.
Yeah.
Like, I mean, I think it's once those stats and things are put out, it's like, well, what do we do? Like what's the solution?
Yeah. And my response to that is always, and this is what I teach in our course that we developed called Indigenous Trauma and Equity Informed Practice. So again, our whole goal of the training that we offer is not just to be voyeurs in the
Right.
suffering of Indigenous peoples, but what can we do about it? WIIFM, what's in it for me? How can I do better now that we've known what these problems are? So my argument is, it's not enough to be trauma informed when it comes to knowing about Indigenous traumas, we need to apply equity into the work that we do. And, you know, you may or may not be surprised, but just the vast amount of healthcare workers out there that really do not know the difference between equity versus equality.
I'm not surprised, trust me.
And it's like it's you know, we have healthcare institutions and organizations and regulatory bodies that are all preaching this equity, patient-centered care, but when I spend time with boots on the ground, it's like, but we have to treat everybody the same conversation. I'm like, that's equality.
Yeah,
I don't
100%.
think we're knowing the difference between equality versus equity here. And so equity is giving more time and attention where time and attention is due. Now, when we look at the residential schools in the 60s scoop and all the state violence, Indigenous peoples need more time. They need more attention. They need more resources. And at this point, Canada's not applying equity to Indigenous nations, groups, or causes or initiatives. In fact, it's not even equal yet.
Right.
It's still understaffed, under-resourced, underfunded.
Yeah.
So that's why systemic racism exists too, is because we're not even equal. We're not
Right.
even compensated equally for these initiatives and things. So we need to catch up to be treated equally and then go one step beyond and actually apply equity, which is even more, because that's where the change will really come.
Right.
And the good news is as professionals, we can all be equitable when we're working with Indigenous peoples. We have these small, pragmatic, everyday uses of equity that we can apply into our practice. If you are a nursing leader or a doctor who leads a team, or a healthcare a professional who leads teams, you can advocate for equity to be hardwired in your policies, your processes, and how your team works with more vulnerable, more marginalized, or more oppressed groups in the country. And we can be more equitable too, just with our own time, our behavior, and our communication. So if you're working with vulnerable, marginalized, targeted groups, slow it down, pause, be mindful of your language and your behavior, and try to go above and beyond the status quo, how you would normally do things, and just use more time, use more resources.
Yeah, no, that, like, I think you hit all of the things that I was kind of thinking about right on the head. And I think this is what people need to hear, right? I think that the fact of, you're right, when I was doing my whole health equity role and just doing like a little bit of a deep dive to understand what people understood about health equity, you're right. Like, most people kind of equated with equality. And then the fact of the matter is, when we're talking about, marginalized populations or oppressed groups, we haven't even reached the equality aspect. So again, you're right. It's time, it's resources, it's money, it's a lot of different things that go into to factor that, it will look a little bit different. And this is why, for example, I've looked at some stats in the US related to, let's say, kidney disease or something. And we know that there's a disparity between, Indigenous people, Black folks, and white folks in terms of how we're treated with kidney disease. And it's like, well, the equity piece of that part from a mental health point is putting in more resources, more screening, more time that might have to be taken with these patients. And again, I think that's what people need to understand, that it really goes back to your why, right?
Yeah.
And I think that's so important that, this work is being done. We're going to continue to put the message out there and have people have conversations. And again, I think this work is so important. It is devastating to see some of the results that I've seen when I worked in quality improvement in terms of health outcomes. We definitely need to see something different.
Yeah. And Len, I really like your approach. It's so simple and it's so easy to understand, right? And I think a lot of times we overcomplicate things, but really when it comes down to it, it's like, be kinder and spend more time with these people. I think we just need to live by these words of wisdom. And the other thing is, I think there's a lot of negative attention given to these issues, right? But we need to focus on what we are doing well. And it kind of bothers me when people say, "Oh, I treat all my patients with kindness." It's like, but if you're talking to someone who has been through all these ACEs, they're going to need a little more than what you give every other patient, right? So I think that's like a blanket statement that people make to show that they are equitable when in fact they're not.
Yeah, I mean, it almost even goes down to the way that we talk about other people too, in terms of like, for example, nursing charting or physician charting. It's about how we describe people, because in that instance, the way someone might be described is the way that you might tend to interact with them as well. So I think
Yeah.
there's so many things that we could unpack and that we could discuss. And again, that's our role, is to say, hey, we got to take this back and take this to the drawing board and do something very, very different with it.
Yeah.
Absolutely.
One of my favorite cultural safety tools that I offer, especially folks who work in healthcare, is training ourselves to constantly examine and re-examine our own language and
Mm,
behavior, our language and behavior, and never taking it for granted that it's all okay, right? Never take it
right.
for granted that it's all okay, because that's the danger zone. If you're just assuming that you treat everybody with kindness and respect and safety and humility, that's a dangerous zone to be in that assumption. So that's something I try to practice, right? It's practice, not perfection, because it's perfect. I'm just going to be transparent. Perfectionism is a value of colonialism, and as human beings, we're not perfect. We are very
Right.
complicated, complex creatures with a lot of judgments and biases and prejudices. So we need to check in with those and constantly just exercise our own humility to examine our language and our behavior. Never assume that it's okay for every single patient and client. So one of the things I do with my team, because we teach this every single day, is if I ever have one of my colleagues who are in my space, I'm like, did I sound okay back there?
Right.
Was I equitable? Was I responsible? Was I in the spirit of allyship and solidarity? And was my behavior okay? Right? I never assume. I never want to assume. I never want to be in that zone of assuming that it's always okay 100%
Right.
of the time, because I will be ignorant and unaware of what my own language and behavior really is. That's where I think the humility is, if we could just let down our guard a little bit to be like, no, we're not perfect. It's practice. And I think that's why we call it nursing practice. Medicine
Right.
practice is because we can't get it right every single time. And when it comes to bias, I think we have psychology research now that shows that like 90% of our biases are implicit, meaning we're completely unaware of them. We don't know what we don't know. And to navigate that, another cultural safety tool I will offer is just checking in with prejudice. Prejudice gets such a negative connotation in Canada. And I say, you don't have to have a negative connotation with prejudice. We associate prejudice as something that's bad, and only bad people do. And I'm like, hold up, we're failing to hold ourselves accountable to the
Right.
fact that prejudice is natural, it's innate, it's inside every single one of us as human beings, and it is 100% impossible to be without prejudice. So we have to stop asking ourselves if we're prejudiced and start asking ourselves, how are we being prejudiced?
Right.
And if we can do that, if we can train ourselves to ask ourselves that with every single person who looks differently than us, sounds differently, comes from a different background than we come from, then we're going to be okay. We're going to be okay.
Wow. I mean, there's so many different things that we touched on. And I think that, you have a fan in me, Len. Thank you for having this conversation. And I mean, I'm looking forward to seeing some more of the work that you'll be doing. I'm going to try to find you on your socials now, if you have
Yeah,
any.
yeah, for sure.
Yeah, I mean, we went through so much today. I really appreciate your time and your expertise. Is there anything that we didn't touch upon that you wanted to share as we wrap this episode up?
Yeah, I would love to leave with your audience just the hope and the inspiration and the motivation. I'm going to leave with you all an invitation to continue your learning. If you're welcome, talking about social medias, feel free to follow me on social media. I'm on Facebook, Instagram, LinkedIn. We have an educational YouTube channel and our own podcast as well, Len Pierre Consulting podcast. So feel free to check us out and continue your learning journey. And thank you so much for having me. I've really felt the unity and solidarity in this conversation. So thank you so much for this opportunity.
Yeah, thank you, Len, for coming on to the Greeners podcast. We'll make sure that we put all of the links in our show notes. And it was a pleasure to have you on as a guest. Thank you so much.
Hi, Chika. Thank you.